My name is Dr. Jonathan Tannebaum. I'm a general surgeon at Montefiore Medical Center in the Bronx. Well, the TTP program has helped me to meet my individual goals by allowing me to get a really broad spectrum of experience and high volume in an urban setting as an attending with really good support. I find that the senior faculty, it's a similar setup to the way that general surgeons used to join private practices when they would come out. And the difference now is, as opposed to working with a senior partner around their junior apprentice, my senior partner is the senior faculty. Within the department, I'm regarded as a attending, but certainly with more to learn in a shorter time. But I find that it's allowed me to get that breadth with good support and come out of it feeling like it was a year quite well spent. The transition to practice program did help impart confidence and competence, certainly. To be in surgery, you have to have some of that. And after 5 years of surgical residency, you're not starting from nothing, but it's an entirely different thing when you are an attending. And there's a different immediacy to care for each patient, from incision to disposition planning. And I feel, having completed the year, certainly prepared to be a responsible clinician with a year of very good experience behind me informing those decisions. I think the TTP programs helped me develop my skills. As I was saying, with the high volume for my particular setting, but also with the unique senior mentorship incorporated with the transition to practice program. You graduate residency with this sort of skills, but again, the learning curve is so different and so much sharper when you are the attending. Although this is a fellowship-like model, you are the attending surgeon for the patients you're treating. So you learn so much more from each thing you're doing. And some of the cases I had the opportunity to do with the senior leadership and mentoring were things that I think would have been outside of my comfort zone to take to the operating room on my own in a smaller private practice or in a community setting where I did not have that backup. So things such as a laparoscopic duodenojejunectomy, which is no small potatoes, is now part of my skill set. And I'm very thankful for that opportunity to have that, along with many other skills, too many to name, which sounds like bragging, but it's not. The TTP program helped to develop my career by giving. Let's rewind for a moment. For me, I practice in New York. It's where I live. It's where I don't have plans to be anywhere else. I want to be in New York, and it's also a place where the best in the country want to go, and that's the competition. So to have a year of experience in New York City as an attending when I'm applying for jobs is invaluable. Quite fortunately for me, it was also a year-long tryout, so I was hired to stay on at my current institution. But in hiring me after that year, they've already seen that I'm a responsible clinician, I'm safe, and I'm good at what I do. So on many levels, it was something that gave me the career I currently have. My experience as a transition to practice associate, to describe it, although I certainly was regarded by the faculty as a fellow, it's a dual appointment, so it's through the house staff office, but also through the Department of Surgery. So I had independent operative privileges. It was credentialed, and with that, I certainly regarded by the house staff that I worked with as the attending, and I was the attending of record. Now, with that, there's graduated autonomy throughout the year, so the support is there, and It's certainly not smothering. And there are times in the middle of the night you wish, like anything, that there was more, but it is appropriate to your level throughout the year, and that backup is decreasing as you move on. So by the end, you are practicing, by the end of June, I was certainly practicing much as I practiced in July of this year as I moved on to be a full-fledged attending. For me, I think the biggest benefit of being a transition to practice associate has been something that was important for my career goals of being in an urban center with a high volume and with senior mentorship to guide me through those through the more difficult cases, certainly which there are higher frequency of as the frequency of cases increases. It was a great opportunity. It's the city that I want to be in, and it's allowed me to stay. So I think it was quite beneficial. Reasons that I think this is important, certainly people will tell you that general surgery residencies changed and people who are graduating are not prepared. For me, however, I'm not interested in no one who has this degree of experience. 5 years of general surgical training is interested in being remediated after 5 years. Now, I think general surgery does a very good job of preparing you for fellowship. However, I'm in general surgery because I'd like to be a general surgeon. I think that in the past, people would graduate from general surgery residency with considerably more experience, because they also had considerably more hours each week that they worked over a shorter time. However, it's provided me with an opportunity to dive deeper into something that, even through my training, I was only able to do for short bursts. General surgery for a month, vascular surgery, cardiothoracic surgery. But now this is general surgery, general surgery, general surgery. And I think it allowed me to be more comfortable with the role without needing to divide my focus, and really refining not just my skills, but also my practice. I'm now responsible for port placement, all of those things that I took for granted as a resident. But I'm doing that now. Well, I was doing that as a transition to practice associate with the support of the senior faculty, but in the role as the attending. I think it was a great opportunity. I think that if I was willing to live other places, if I was willing to do things differently, certainly I could have gone into practice without this. But I think to be where I want to be and for what I plan to do, I think this was a wise move, and I'm thankful for the opportunity.